Now, this morning, the Health Minister Dr Zweli Mkhize said that the Johnson & Johnson vaccine will be rolled out to healthcare workers from next week, while the Pfizer injection will also form part of the phase 1 of government's plan. Now, government is moving to try and reassure South Africans that it is on top of the vaccination process. But the question is whether this has been effective thus far. Let's speak now to Dr Aslam Dasoo, and he's the convener of the Progressive Health Forum. Dr Dasoo, thank you so much for your time. Good to have you with us this afternoon. Perhaps let's start with some of the sentiments that we have experienced from various groups. There is an anti-vaccine movement, a lot of speculation about the vaccine, a level of mistrust that some South Africans have about perhaps not just the efficacy of the vaccine, but how it will affect the human body. Where do you think that this stems from?
Well, I think the anti-vaxxer sentiment is worldwide. It's quite widespread. And the pandemic has certainly fueled it. And it's not really surprising to see why. I mean, I think the interconnectedness, the anxiety and the alarm around the pandemic, and the lack of clarity in messaging, I think, coming through from governments, from society, fuels all of that. It's likely that as vaccination rates begin, that kind of sentiment will reduce as people begin to see the efficacy of the vaccines.
And what impact regarding this do you think the latest AstraZeneca setback has had on the efficacy and government's efficiency in rolling out the vaccine?
Of course, this is a problem, and perhaps it's just better that everyone just needs to take a deep breath. I think from Sunday night there has been a lot of speculation that is completely unjustified, but also a lot of concern, some of which is justified. And again, I think it's around the full messaging that people do not yet. What we heard quite clearly was that the trial results of the AstraZeneca vaccine, which was proved to be very effective against the wild type virus, the original virus, has proved to be less effective against the variant that has emerged in South Africa. Now, that being said, the government, together with the scientists conducting trials on the other vaccines here, moved fairly rapidly in order to prevent precisely what you asked in your first question, increasing a loss of confidence in vaccination as a result of this. And the J&J Janssen vaccine, which was trialed here and fortuitously looked specifically at the issues that are important to us, with respect to efficacy in particular, has results that's quite good, and they moved quickly together with Johnson & Johnson to see if we could replace the AstraZeneca vaccines that were due to be rolled out with the Johnson & Johnson vaccine. Now, it's important to understand the following. The pause on rolling out the AstraZeneca vaccine doesn't mean it's being discarded. The pause is there to give people time to review the results, to understand the full implications of those results, and to make appropriate plans regarding its possible use. However, it is important that once you have made a commitment to people, such as we have, for example, that we are going to start vaccination on a particular date in a particular cohort of people, in this case, health workers, that you do all you can to meet that commitment. And to this extent, I think it has been successful. What we've heard is that the Johnson & Johnson vaccine will be made available to us on an emergency basis, and that vaccination could begin as planned anyway within the health sector in particular. As you're aware, of course, that health workers are most at risk, and this is the correct place to begin. So it's important that we all take a deep breath. As I said, there is no need for panic. This is a dynamic situation around the world. There's no single event that's going to get us out of this, the emergency phase of the pandemic. It's going to be a moving target, and the virus is a very wily thing. As it feels pressure, it mutates. And there's nothing to prevent it from mutating in the future against the current generation of vaccines beyond AstraZeneca as well. But vaccine science has moved rapidly so that new generations of vaccines are already in production to avoid exactly that scenario.
So, Dr.
And
Dasoo,
so,
what could government have done differently in order to have gained more public trust in this entire vaccine procurement as well as vaccine rollout process?
well, I think the first thing is that it could have overall, and this is a general point, it could have communicated better with people. Now, again, people will say, well, how long is a piece of string? How do you communicate better? Well, there are ways of doing that. So that's the one thing that I do think that people need to reflect on, the level of communication. But I don't think there's anything that the government could actually do about the circumstances that have arisen with the AstraZeneca vaccine. We procured the vaccine, it arrived, and there was a fatal coincidence that just when it arrived, these results emerged, which required a rethink, and that's what's happened, and it's been paused right now. But more than that, a replacement was found, an effective replacement. So I think all in all, we're pretty much where we were before this whole kerfuffle about the AstraZeneca vaccine. But just to come back to the point, to get out of the emergency phase of the pandemic, vaccines are the only instrument that we have in our toolkit worldwide to get us there. Now, in the first instance, we have to protect the vulnerable against severe illness, which is, the priority right now. Herd immunity will follow in due course, but that's a secondary goal now. And I think the scientists and the government are reaching a meeting of the minds on this. And most importantly, I think it's for people to understand that there's no need to panic. You have to maintain your primary protective measures. That is always imperative until we reach a level of population immunity when, we can say safely we're out of the emergency phase. But for now, I think the plan is in place and the rollout will occur as envisaged.
Dr. Dasoo, let's take a look at some of the comments that have been making the rounds on social media, just really highlighting some of the sentiments from some of the citizens. We've got Edmund here who says, the expiry date of the AstraZeneca vaccine is really not an issue. It was going to be used up by April anyway. The issue here is the fact that it's got minimal efficacy against the SA variant. The order should have been cancelled the moment the South African variant was discovered. That's one comment. Another one from Putumile says, Dr. Mkhize said Johnson & Johnson rollout will begin next week. If cabinet approved, as manufacturer has promised, delivery will be made as soon as approved by relevant authorities. AstraZeneca might be swapped or sold before the expiry date. The matter of calculation is theirs. Let's look. This one is from E or L, who says, I really hope these vaccines don't go to waste. If we don't use them, surely we can send them elsewhere to those who would. This should be planned ASAP, because #expiry, #vaccine rollout SA and AstraZeneca. And one here as well by Kariam, who says, why did the government not check the efficacy of the AstraZeneca vaccine before purchasing so many doses? What a lot of wasted money. There you go, Kariam there. And Dr. Dasoo, varying views from South Africans, but the underlying thing is that, blame is being apportioned many of the time to government for not checking the expiry date, for what they should have done when they found out that the SA variant existed. Just your thoughts and your sentiments regarding some of the sentiments and concerns and genuine concerns that South Africans have.
Yes. First, let me say, I'm actually quite pleased at the level of understanding in all of those tweets about the situation. While they're, of course, not all accurate, and conditions are not quite as described, there is a level of understanding. So let's just talk about the expiry date issue, because that seemed to be a big issue. So the expiry date for this batch of vaccine that was ordered from India is, I believe, in April. Now, it is in all likelihood that expiry date, as was explained by Professor Karim yesterday, is a review date, because we don't yet have a period along which vaccines have been issued and can accurately be tracked for expiry. So what would have likely happened if we had gone ahead and there was no problem with the AstraZeneca vaccine is that we would have rolled out what we had. Had we still had doses before the expiry date, those would have been swapped out with the manufacturer, and we would have gotten doses that would expire later. So this is not really an issue of major concern. The issue about whether we've spent too much money and why didn't we check on the results, you have to understand the trials are sequestered, that to protect the science, there's no ability for anyone to find out the results of the trial until the results are ready to be published. And this gives certainty to the community of scientists and authorities worldwide that the science has been done properly. Now, there's no way the government could have known that the results were what they've turned out to be. So, like I said, it was a fateful coincidence that we've experienced this. When we discovered the variant late last year, we were concerned that the variant may escape the vaccines that we have. And the trials that were underway enrolled people even at that time who had been exposed to the variant. And the results show that in the AstraZeneca case, that the efficacy is much lower, but the trial cohort is too small to make a definitive finding on that. That is why there's been some confusion. Now, if you take it compared to the J&J vaccine, they specifically had started by looking at the cohort of patients who would be at most high risk of disease. And in fact, the resulting trial that followed after the variant emerged showed that it had an acceptable efficacy against the variant. So it's just around the vaccine science. As I said, it is a bit of a moving target. It's a dynamic situation, and it's important that authorities are nimble and flexible so that you can, adjust to the changing conditions.
Dr. Dasoo, before I let you go and before our time runs out, there's also the issue of the non-disclosure agreements. And this is something that comes out irrespective of which manufacturer of the vaccine you're talking about. Given the fact that there's so many loose ends and so many unknown factors when we look at the vaccination process, should there not be more available about the nature of the agreements that are being made between governments and providers of vaccines? Also, just as a measure of instilling public trust that there aren't any ulterior motives behind some business transactions.
Sure. I mean, I think the suspicions are there, and it's very hard to allay all of those fears. But it is a bit of a red herring, these non-disclosure agreements. These are standard practices in procurement of drugs, pharmaceuticals, vaccines, and are not a remarkable. These NDAs are not remarkable in any sense. I think the fact that this was all concentrated in one time span that brought up a whole number of things, I think people draw inferences that may not be justifiable in this instance. So I think, again, we need to just unpack this properly and say the NDAs are commercial issues between buyers and sellers, and that relates mainly to the pricing and so on, but not to the science. Remember, the science is sacrosanct in this process, and so the NDAs don't cover any of that, and shouldn't in any sense. So again, people's suspicions, while understandable, are not valid in this regard. I think it's important people just take a deep breath. We are on track, no need to panic. And as things move, once vaccination begins, you're going to find that what we thought we're going to be doing a month ago will again have to change. And, again, nimbleness, flexibility will be the key watchwords here.
Well, thank you very much, Dr. Dasoo. I guess it really does say that the only thing that's constant is change, and that certainly seems to be true in a situation such as this. Thank you very much for your time as well as your insights. That's Dr. Aslam Dasoo there from the Progressive Health Forum.